In the United States, more than 115 people die from opioid overdose daily. This category of drugs ranges from prescription pain relievers like hydrocodone and codeine to illegal substances like heroin and its hyperpotent synthetic version, fentanyl. Opioids suppress the central nervous system and thus are prescribed by medical professionals to treat severe pain. Unfortunately, the addictive nature of opioids has led to their widespread abuse and misuse in the United States. On October 27, 2017, the U.S. government declared a national state of public health emergency in response to what public health officials are calling the Medusa of epidemics. The current opioid crisis costs the country $78.5 billion a year in healthcare, criminal sentencing and detention, and addiction services. Many news outlets blame the overprescription of painkillers for the epidemic, decrying the irresponsibility of modern pharmaceutical companies. But opioid use and addiction has a much longer history. Opium is derived from the Papaver somniferum plant, commonly referred to as opium poppy. Poppy is native to areas of Asia Minor, northern Mesopotamia, Persia, and India. Some scholars argue the plant's pharmaceutical effects were known as early as the 2nd millennium BC, as indicated by a late Minoan clay idol of a poppy goddess. One of the earliest written mentions of the plant can be found in the 8th century text, the Theogony of Hesiod, but poppy occupied an important role in pharmacology throughout the ancient world. It was certainly in use by the Islamic Golden Age, which ranged from the 8th to the 14th century AD. During this time, scholars such as Rhazes, Abu Qasis, Hali Abbas, and Avicenna wrote many of the foundational scripts for Islamic medicine. The medical compendiums they produced were touchstones of medical knowledge throughout the Islamic world and Europe alike through the 16th century. Avicenna recorded the pharmacopoeia of opium during this time in his book Canon of Medicine, which contained 5 volumes detailing various drugs and their properties. Opioids are a suppressant, and as such poppy was used predominantly for its analgesic properties. Other effects of this drug included hypnosis, cognitive distortions, antitussive effects, respiratory depression, neuromuscular disturbances, sexual dysfunction, and toxicity. Opium was indicated in the treatment of acute, severe, and chronic pain, including headaches, arthralgia, otalgia, toothache, labor, kidney, and bladder pain. Avicenna emphasized that opium should only be utilized after treating the source of pain, due to its negative side effects. Within his canon of medicine, opium was treated as a last resort. In Avicenna's words, physicians should be able to predict the duration and severity of pain and patients' tolerance, and then weigh the risks and benefit of opium administration. During the 9th century, Islamic alchemists viewed opium as a poison and were very cautious about its application. It is speculated that Mecca, a city located within the Mediterranean peninsula, suffered a widespread opioid addiction crisis. Avicenna's 5th book goes into the toxicology of opium, explaining how to recognize and treat people who have overdosed. The symptoms he listed included old extremities, pruritus, opium smell, vertigo, hiccup, disturbed vision, impatience, difficulty breathing, yellowing or dark skin color on extremities, pale face and lips, drowsiness, inability to talk, and depressed eye. Mandragora, or mandrake, was another analgesic used in medieval Islamic medicine. Islamic physicians likely drew on the Greeks' knowledge of this plant, who knew of its effects from both the Assyrians and Romans. The Assyrians mixed an herbal concoction of belladonna's, cannabis, and mandrake, while the Romans mixed mandrake with alcohol to form analgesics. The use of mandrake was noted in several Islamic medical texts, like the one titled The Delight of the Minds Concerning the Improvement of Bodies by Daud ibn Umar al-Antaki. It was used to treat animal bites, poisons, skin diseases, psychiatric disorders, epilepsy, hemorrhoids, sexual dysfunction, and internal diseases. A chemical extracted from mandrake, called etoposide, inhibits enzymes necessary for continuation of the cell cycle. For this reason, it is used today to treat several kinds of cancer. The mechanisms of anesthesia and the variety of other ways it was used in Islamic medicine remain unknown. Clearly, humans have been using and misusing opiates for a long time, When used in moderation, they can provide necessary relief for some of the most painful human conditions. However, their equal ability to exact pain, on both the users and their loved ones, is as troublesome and pernicious a problem today as it was in the golden age of Islamic medicine. Modernity's habit of disavowing and simplifying complex histories might be leaving behind some important and hard-earned lessons about opioid addiction from the ancient world. While these histories continue to be reclaimed and disentangled, we would all do well to heed Avicenna's advice. Opium should only be used after treating the source of pain. Discovering the source of pain that drives modern Americans to opiate addiction might be a burdensome task, but it's one worth undertaking.